Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. Good morning, everyone. I hope it's a good day for you.
Good morning, Doctor. How are you this morning?
I'm here with John Taronsky. Good morning. How are you?
I'm doing well.
We've got Aaron and Coop in the controls, running the booth, making sure everything is A-OK at
right.
WABC.
The team is here.
So I just want to spend a moment to remember John Kennedy, the president, shot 50 years ago. Only about 25% of Americans are old enough to remember President Kennedy. So I was surprised to hear that for most of us, and probably most of the listeners, we remember that day like yesterday. And we remember where we were and what happened and those 4 days of chaos and tragedy. And I just want to take a moment to reflect on his life. So 50 years since that moment. This week we had very interesting patients, and I wanted to speak about them because patients, when you think about each patient, and I try to think about every patient, I try to spend a lot of time with my patients. Some patients come to me and they say, my doctor spent 2 minutes with me or 3 minutes with me or 5 minutes with me, which is unheard of. I usually spend an hour or 2 hours with everyone who comes in, and we get the documents. We find the pathology, we find the tests, we find the blood tests, and I make a copy for the patient. So when they leave with more than they came. They leave with more knowledge, more information, more documents. They have a record of what's happened to them before they even came to me.
That sounds like a good plan, Doctor.
So we have a staff that's running around chasing documents from years before all over New York, all over the country, sometimes all over the world on patients who've had things done, and they don't even know they've had things done, or they don't even know the results of things.
Yeah, sure.
So we had a patient come in this week, and I spoke a little bit about the patient actually last week. It's a patient from California. They live next to one of the most famous hospitals in America, the hospital that developed CyberKnife. Okay, why do they come to Dr. Lederman and Radiosurgery New York when they live next to the inventor of CyberKnife?
Well, I would...
Well, they came for lots of reasons.
Yeah.
Number one is, if you have a tumor, you want to go to the person that has the most expertise. You want to go to a team that's together that has the most expertise, the best track record over years. They know that the newest gizmo is not necessarily the best gizmo. In fact, the newest gizmo is, by definition, the least proven gizmo, right? So you get on the newest gizmo, there's no track record. There's no proof. There's no legacy of what's going on. This man was a pilot for United Airlines, okay? So he knows what new gizmos do.
I'm sure he knows all about them.
He knows all about new gizmos. He flew for United for 30 years. He flew around the world. He knows new gizmos, old gizmos. He's had an acoustic aroma. He came in, and they purposely came in. We had a lot of conversations on the phone beforehand. They decided they're coming because we have the largest experience treating acoustic neuromas, which is a particular kind of brain tumor in the world. We've been at it for more than 20 years, nearly 25 years, and we have a beautiful track record. Our work is non-invasive. There's no cutting, no bleeding, no hospital stay. We have a team that's devoted to do this.
Right.
So it's a big plus for the patient.
I would certainly think so, definitely.
Now, one of our advertisements says Dr. Lederman is the only doctor who is board certified in internal medicine, medical oncology, and radiation oncology that's Harvard trained in New York City. So each of those specialties is 3 years. I trained 9 years after medical school. I went to school until I was 35 years old, continuously from age 5 to 35.
A lot of time in a classroom.
Well, it wasn't classroom. A lot of it was with patients
Right.
and in medical school and hospitals and training. So what does that mean? Well, for this man, he's a pilot for United Airlines. He came in with acoustic neuroma, and I examined him. I examine every patient.
Sure.
Well, not every doctor examines every patient.
It sounds a little hard to believe, but
it's a tumor in your ear. Let's look at your ear, maybe.
Yeah, sure.
So I examined him, and he had atrial fibrillation. Atrial fibrillation is when the heart beats irregularly. And actually, when you have atrial fibrillation, about 25% of the people with atrial fibrillation end up dying of strokes. Because the heart's beating irregularly, the heart can't push all the blood out like it does in you, or hopefully me.
Right.
And so the blood stagnates there, it turns to a clot, and then the clot gets sent out to the brain one day, causes a stroke, and the patient dies. Gotcha. So there's a man who came to me because of our track record with acoustic neuromas, that we have the largest in the world, that we have a team that's been together. We've been doing this for more than 20 years. And he ends up, hopefully, having his life saved twice. Number one, acoustic neuroma. Yep. He had treatment. He tolerated the treatment fine. We found the acoustic neuroma. He's now under treatment to get his rhythm back to normal. So I just comment on, there are advantages to have a doctor who's trained in more than one area, who really looks at the patient, examines the patient, and spends an hour or 2 hours with the patient to see what's going on, rather than assembly line medicine.
Right.
So we're lucky in our center that we're able to spend time with each patient and evaluate each patient and see what's going on, get documents, and do the right thing and send people for tests, whatever is necessary. So to you, Capitan, I'm glad you had a great trip back to California. They had a great trip in New York, and I hope his life was saved twice. So I had a funny email last night. Okay, many people hear the program, and they too bashful to call because they don't want to call us.
Yeah, we are live. I mean,
yeah, we're live. We're here. We're 2 blocks from Radiosurgery in New York from our office. I get to go to my office. I got a big muffin in my office. I walk over here. Here we are live Saturday morning, 50 years after the tragic shooting, murder of assassination of the president. So this man wrote me a letter. He said, well, tell me the truth. What do urologists choose for their prostate cancer treatment?
So asking you, what are your...
what is a urologist?
Right.
It was a surgeon who... Sure. His job is to cut on prostate cancer.
Right.
What do urologists do for their prostate cancer? So I guess it's like, what kind of toothpaste do dentists use?
Right, exactly.
Because I asked my dentist a few weeks ago, what kind of toothpaste do you use? And she said, are you crazy? They're all the same. Just brush your teeth.
Right.
So anyway, I wrote him back, and I said, the question really isn't, what do urologists do for prostate cancer treatment for themselves? The question is, what do intelligent people do for prostate cancer?
Right.
Okay, so what does an intelligent person do? Well, an intelligent person would look at the data, right?
Everything else, sure.
I mean,
analyze the data.
Do you want to believe that Crest is the best toothpaste or whatever, or XYZ is the best toothpaste? There's probably data out there, and probably my dentist looked at the data and saw that, you could buy one for 99 cents or you could buy one for $19.99, and
the outcome is the same.
Probably if you floss and you brush, you're probably A-okay.
Right.
Anyway, so I said,